In this video, we're going to be discussing what is a cervical exam and what it means during your labor process. Welcome to the MamasteFit YouTube channel. I'm Roxanne. I'm a labor and delivery nurse and student midwife, and we're going to be discussing what exactly a cervical exam is and what does that mean for your labor. A cervical exam is a manual assessment your provider is using to see 5 different things with your cervix. Number 1, how dilated is your cervix? How open is it? This is ranging from 0 to 10 centimeters. From 0 to 7 centimeters, around 8 centimeters even, could be true 0 to 8 centimeters on a ruler. 9 and 10 centimeters is not truly 9 and 10 centimeters for most of us. It's just, is there still cervix all the way around, but it's bigger than 8 centimeters is usually 9. And then when that cervix is no longer found around the baby's head, then it's considered 10 centimeters. Each baby's head is a different diameter, has a different circumference, so it can be a little bit bigger or a little bit smaller than that 10 centimeters when you are what we would consider completely dilated. The second thing that they're assessing for is the effacement, so how thick the cervix is. They're also assessing the consistency of that cervix when they're doing the effacement. So is it soft or is it still really firm? We want the cervix to be soft and slowly starting to thin out. Effacement is a percentage from 0 to 100. 0 means that it's still very thick and usually pretty firm. 100% efface means that that cervix is paper thin, very soft, and very stretchy, where you can almost stretch the cervix out even wider when it is that 100% effaced. The third thing that they're going to be assessing for is baby's station within the pelvis. So is baby engaged? So is baby +2, -2, 0 station? Where exactly baby is within the pelvis and what presenting part? Is it the head or is it the butt? And then the last thing that they're assessing for is where the position of the cervix is. For most of us during pregnancy, our cervix is positioned behind the baby's head or posterior to the baby's head. And this is a protective mechanism so that nothing is manipulating the cervix or touching the cervix that could cause your body to go into preterm labor. And throughout the laboring process, that cervix is going to move more and more anterior for it to be easier to dilate as well as for the baby to come out. So that is the 5 things that they're assessing for when they're doing a cervical exam. Number 1, dilation. Number 2, effacement. Number 3, the consistency of that cervix. Number 4 was the station of baby within the pelvis. And then the 5th was where was the cervix located, posteriorly, or is it more anteriorly, or is it kind of in the middle? What does this cervical exam mean for you, though? If you get it during pregnancy, a lot of people will think, oh, this will tell me when I'm going to go into labor. That's not true. It is not a crystal ball. You could be 0 centimeters dilated and go into labor tomorrow, or you could be 5 centimeters dilated and still not go into labor for 4 more weeks. It's really just telling you how open your cervix is. If you are more dilated, it may be an indicator that you might have a quicker labor, but not always. During labor, it is still an indicator of how your labor is progressing, but it's not going to tell you how long you're going to be in labor. Some people will say on average, people will dilate at 1 centimeter every 2 hours, but that's just a very generalization of the average of people. But some people will dilate quicker and some people will take longer because we all are very individualized and we all have our own labor curves. The reason that they check the dilation of you is 1, so that they ensure that you are in active labor when you get admitted to your hospital. Because they don't want to admit you when you're in early labor because this increases the likelihood of having to do unnecessary interventions, which could cause that cascade of interventions. It's also a place that not many of us are comfortable, so if we can limit the amount of time that we're at a hospital for a labor, the better. The second potential benefit is that it can tell your provider, if they're not in the hospital, to come to the hospital to be able to be there for your birth. Some hospitals, the OB and the midwives are not located in the hospital 24/7. So if that is your provider, a benefit of having that vaginal exam could be for your nurses to notify those providers to come on in. So just to recap, a cervical exam is not going to tell you when you're going to go into labor or how much longer you're going to be in labor. It's really just telling you how open is your cervix, how thick is your cervix, and the consistency, is it firm or soft, where baby is within your pelvis, what station baby is in, and then is the cervix posterior or has it moved more anteriorly? This could tell your provider whether or not you are in active labor and need to be admitted to the hospital, or if your provider is not located in the hospital, to come on in because you're likely going to have a baby. If you want to learn more about childbirth and what to expect during labor and pregnancy, check out our online childbirth education course where we break down the science of labor and birth so it could take away that fear associated with it. We discuss labor positions and birth options, as well as if you have to be induced, we break down different induction methods. And if you want to grab our online childbirth education course, you can use code YouTube10 to get 10% off any of our courses and fitness programs. If you enjoy this video, please like and subscribe to our channel so you can be notified when we release new videos. We release 1 to 2 educational videos and 1 workout video every week. If there's a topic during pregnancy or postpartum that you're wanting to learn more about, drop them in the comments below.